The Parkinson's Podcast is brought to you by the Davis-Phinney Foundation and brings you the stories, wisdom, and expertise of people living with Parkinson's, care partners, and Parkinson's professionals. In this episode, music therapist Hadley Rentz explains the benefits of music therapy for people living with Parkinson's. Welcome to the Parkinson's Podcast. My name is Sia Euros, and I'm your host here with the Davis-Phinney Foundation. And super excited to have our guest here today, Hadley Rentz, who works at Worx, which is an organization that has been around since 1987, serving Southern California and San Diego in particular. They do all kinds of work with individuals and groups and virtually. Music therapy has been, shown to be effective for things like dementia and strokes and even like surgery, recovery, mental health, pain management, all kinds of things. And it is also effective for helping people that are living with Parkinson's. And that's why we have Hadley here today to talk to us more about music therapy for people living with Parkinson's. So I don't know if you want to introduce yourself and maybe tell us a little bit about your background.
Yeah, my name is Hadley Rentz. I'm a board-certified music therapist, and I actually completed my internship with Worx. That was what brought me out to San Diego. And since then, I've worked for a hospice company out here and have been now back with Worx for almost a year.
Fantastic. Yeah. And it was really cool because I got to observe you giving a group kind of lesson in Chula Vista, California, which is it's south of San Diego. And it was just such a great group activity, between speakers and, with the instruments and, people with Parkinson's in all different stages were able to participate and sing and dance and move. And this past week, I got to attend one of your colleagues' virtual classes, Audibility, which is a class for people living with Parkinson's that's been ongoing for many years now. It was really cool to participate with that group and just to see firsthand the kind of work that you do. So I was just wondering, so how does music therapy help people with Parkinson's?
We offer physical support, emotional support, mental, cognitive functioning support, and social support. Kind of a blend of that. So music therapy specifically for people with Parkinson's might be able to help delay or manage some various symptoms physically and could maybe uplift some of the emotional or social kind of aspects.
So what does make it effective, a music therapy in particular for Parkinson's symptoms?
Singing, for example, somebody with Parkinson's might be struggling with swallowing, might be struggling with dictation, making their speech clear. The volume of their speech might start to trail off toward the end of sentences. And the range in the voice often becomes more monotone over time as someone's voice is affected by Parkinson's. So we can use music to kind of combat all of that and try to at least maintain the quality of life that somebody is currently at. Movement is getting the whole body trying to entrain with rhythm can be quite helpful. Parkinson's, often you have what would be referred to as the shuffle. So people not lifting up their feet as they're walking, and that often leads to tripping, can lead into different accidents. So marching kind of music can be very helpful in giving motivation to movement, picking up your feet and marching them one by one to the beat of the music can start to train us on hopefully, avoiding some of those accidents. Mindfulness that we often lead like a music kind of guided meditation or music guided imagery could be used to help pull somebody out of maybe anxiety or depression that they're having.
What are some of the other, you mentioned some activities, but what are like kind of all the different kinds of activities that one might do in music therapy, and how might that be different working with an individual or working with a group?
Sure thing. Yeah, I mean, each music therapist is going to lead differently. Their individual and group sessions. So let's see, an individual session, I work with adults and older adults specifically. So I work more in the hospital, with hospice and with older adult daycare kind of facilities out here, kind of nursing rehab centers. And in individual sessions, it's really nice because you can head into a room wherever you're at having your session and really personalize it. That's my favorite part about working individually is you can ask, directly to your client, patient, participant, how's your pain? How's your anxiety? How's today going? And then from there, I usually go into, instead of maybe what kind of music do you like? Well, I'll ask what kind of music are you in the mood for? If they've agreed to music therapy, I usually give some kind of an introduction to it first, right? As I did in this interview here, it's important that people understand what they're getting into, what they're being offered. So I usually ask what music they're in the mood for, what sounds good today. If they're able to give me an answer to that, wonderful. Then we can start to work from there in me playing the music for them and them singing with me, in participating in instrumental play, analyzing lyrics, songwriting, a variety of methods. And it's generally found that the music somebody prefers, music that's familiar to them, is what they're going to respond best to. Both preferred and familiar in a way. So, I love old Mexican music. When I hear that, it just gives me like good kind of feeling. And music listening has been found to increase dopamine levels that are output into the brain. That along with like oxytocin, and it might be able to decrease cortisol, which would relieve stress. And so a variety of different things, using the music somebody prefers is important, and not diving into, say, somebody's had an awful day or have a lot of pain, and now you're putting on music that they love country, but you're playing hard metal or whatever it might be, that they're like, no, turn that off. Music can also cause harm. So important to take into account the individual. So it is nice in an individual setting that you can really personalize an experience. With music therapy, we set goals and we set objectives and we track data and we document. And so it's all for the sake of being able to, again, better someone's quality of life. And the more that we're able to collect data on that and track, whether it's just there in the moment observing or continued assessment or after the fact, to be able to tailor to somebody's needs and their strengths as well, their preferences. In terms of a group, in leading a group, usually, like I, for example, have led a Parkinson singing group before. Usually we start off with some vocal exercises, again, working on that breath support, on maintaining the vocal range, vocal volume, dictation. So all these different kinds of things, helping with that swallowing too. Singing will help with that. So all these vocal exercises, moving up and down a piano, using the music to cue, to motivate what's going on. So I'll give like a 5-7 chord into the one, and the 5-7 leads that, something that you can hear wants to go to this. So it encourages you to continue on in giving that positive reinforcement that we find. So a variety of usually vocal warm-ups that we do. And then the more that any music therapist can use music to their advantage, it's going to be an advantage. The more that we can use music to motivate what's happening, the less work we really have to do. So if we go into that, it's something, some kind of movement, whether it's stretching, whether it's, more of an active kind of repetitive exercise, we want to use music to cue it. So if we're doing marching and people with Parkinson's having that shuffle, we want to work on feet up and down. So for example, classic When the Saints Go Marching In, nice old song. If you're working with somebody who's older, we want to put the emphasis of the music where the amount of effort is most required for the movement, if that makes sense. So if you think about marching, as you lift up the leg, it takes a lot more muscles to lift your leg up than to just drop it down with gravity. So on the emphasis of the music, we'll find that emphasis of the movement. So when the saints go marching in, oh, when the saints go marching. So then we're going to use the music to and then they're dancing all right, here we go. And you kind of forget that you're even putting in effort on that march. If you were to do something like a nice flowy breathing exercise or something like rolling your shoulders, something more circular, you might find a 6/8 or a 3/4 kind of rhythm, something that's nice and da 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 da, like a nice flowy. And then also in that group, we did moving on to finding sing-along kind of songs. Right now you have the group camaraderie. That's certainly an advantage of working in a group, is you have the social aspect. You have people to share in that experience with. And working in, I was thinking of this song that we worked with would be Your Cheating Heart by Hank Williams. That one starts with, your cheating heart will make you weak. So at the end, you're holding that breath all the way out, really encouraging them to sustain that breath, and then still the articulation at the end of the line. So finding ways that we can use music to really motivate things, it takes off the work for us as music therapists, and then also for the clients themselves, makes it more motivating.
So how do you work with other healthcare professionals to plan for Parkinson's, for people living with Parkinson's?
Yeah, that depends on what kind of setting we're in, but our goal is to always collaborate as much as we can with the interdisciplinary team. Whether it's doctors, nurses, occupational therapy, physical therapy, speech therapy, spiritual care, social workers, whoever it might be that's available to us. I'd say that the more we can collaborate, the more that we can learn from their specific disciplines, while also, respecting and knowing that we each have our own. We can each learn from each other. And then we can also communicate. And the more that we're communicating about a specific patient or participant, a specific client, the more that we can understand what's working, what's not working, what are they still needing from us. So collaborating certainly with any discipline that we have around, we're happy to do. Makes my job, again, easier usually, and generally benefits others too.
Can you share a story about how music therapy has improved a person with Parkinson's life, or and the caregivers or families, things like that?
Let's see. So I had a client in this group that I was leading, the singing group, who used to go out hunting, and had a couple dogs who, when they went out hunting, they'd call out to the hunting dogs, and realized that over time their voice was starting to trail off. So we're talking more about the breath support and the vocal volume, that over time was decreasing. So we worked in our singing group in many ways addressing that and other aspects of how the voice is changing due to Parkinson's. And so now over time, we start tracking how much can their vocal output be as they sing. And so working to try and at least maintain the current quality of life. And then family support can be beautiful too. I've had multiple hospice patients with Parkinson's, and it's so important that we can be able to provide support to patients, clients, participants. I switch that word depending on what setting we're in, and themselves, but also their family unit, whatever that might look like for them. And being able to have family, friends, neighbors, whoever it might be, involved in sessions, whether it's individual or group, whenever possible, or to give insight, right? If we're not able to gain as much insight into a patient's preferences, that family can be able to provide that to us. And then if they can be involved, now we're reminiscing about some beautiful moments that they might have shared together. We're maybe doing like a legacy kind of project, something to remain with the family and loved one when that time comes, and so many different ways. But I'm very blessed to have and lucky to have worked with so many beautiful patients and families, allowing me into such vulnerable moments.
And how might, if you were like working long term with somebody living with Parkinson's, how might like the treatment change as Parkinson's progresses?
Again, it's going to depend on the individual and how responsive they are. But that's, our goal in music therapy is that like we have our referral, we have our assessment, we have our treatment, and we're collecting all the data. And with an assessment, like I mentioned, we have like that on the onset, the initial assessment. So how we're first seeing how things are going, and then a continued assessment, whether that's within a session, just as we're continuing in one, 60 minutes or however long we're with them, continually observing both verbal and nonverbal feedback from a patient. And then over time as well, we want to constantly be adjusting those goals and objectives once we've met them, or if they're not working, if they're not supporting the patient's needs and strengths, then what can we work toward that they're wanting? That's important to be able to factor in what is the patient or family needing, and then how can we continually support that? So it certainly will change over time. Usually we'll do like, say, the same warm-ups for a while, and then once they get comfortable with those, we can keep moving on to continually support those needs.
I was wondering if you could say more about the Audibility weekly class that you have, because that's a virtual class that's open to anyone that wants to join it, or is it just for people in San Diego area? Or I was just wondering if you could say more about that.
Yeah, it's available to anybody living with Parkinson's, and then their loved ones are encouraged to join if they'd like, to have that support as well. I personally don't lead that specific group, but right now I believe we have it on Wednesdays. And like I said, it mixes in that mindfulness, that singing, harmonica play, and movement, kind of a mixture of all that. Yeah, so if you are interested, please reach out to our company, Worx Incorporated, and can always put in a note to us if that's something that you'd like to learn more about. We're happy to provide more information and move toward, having you be an active participant.
Yeah, we can provide some links in the description, when we post the podcast, so that people can easily find your organization. I think that'd be really cool. Do you have any last thoughts or things that I missed that maybe I should have asked that you'd like to share? about being a music therapist or music therapy and Parkinson's?
I know the event that we met at was down in Chula Vista. And that's something, as we're talking about research, there's also a continued need for support for Spanish speakers. And we find that very often down here in San Diego. About half of my caseload is Spanish speakers. And there are certainly very few of us in the music therapy field. So I would encourage anyone interested to also reach out and ask questions and let me know if that's something that you're interested in. I'm happy to talk with anyone about, music therapy. I'm lucky to say that I love my job and that every day I can come home reminded of how fortunate I am. And so I can talk on and on and on about it. But there certainly is a need for support for Spanish speakers, especially when we get into working with adults, working with older adults, and having some very intimate, some very serious, emotional conversations, things like that, to be able to fully support a patient participant. Culturally, there are many differences between Latin America and the United States, and whether that's any outlook on mental health, whether that's access to actual offices or to services, or even just having a translator guaranteed in an office or written materials translated into your native language, whatever it might be. Certainly a need that's needing to be filled. So if anybody is interested in that or has questions about that, please feel free to reach out. But I'm excited about the potential for growth opportunities in being able to offer more opportunity, more support to that community. It's very dear to my heart, and look forward to continuing collaborating with the entire Latin American community, Spanish community, Mexican community, wherever it might be. Most of our clients are from Mexico, but we certainly don't stop there. So I'm grateful to all of the music, all of the knowledge that I've learned on the culture from those patients, from those families, and look forward to continuing with that.
Fantastic. Yeah. At the Davis Phinney Foundation, during these last few years, we're like exponentially growing our Spanish resources for people living with Parkinson's. And we just like last month, we started our own, we have a separate YouTube channel now for webinars and things like that in Spanish. And so like, hopefully at some point we can have an interview in Spanish about music therapy. So to get out the word more, because it seems like, even within the English speaking population, a lot of people don't know about music therapy, and it could be even less so in the Spanish speaking. So I feel like you said, there's very few Spanish speaking music therapists in the US right now. And so getting the word out would be really, really cool.
Yeah. And I so appreciate the work that you all do, and in exactly getting the word out and being able to support and just make people aware of what their options are, what their resources are. Like you said, even for English speakers, not knowing what music therapy is, and then not knowing how maybe music therapy can support someone with Parkinson's. And then you get into Spanish speakers. And then something like a podcast can be listened to anywhere in the world, right? If you get out into other countries, there are only a handful of countries that even have a national music therapy organization. So many people are maybe could benefit from, but aren't even aware that it's an option, that it's available to them. So it's wonderful work that you all are doing. I appreciate cultivating that community, being able to allow education in both ways for everybody.
Yeah, and we'll definitely I'll put some links in the description also to our Spanish our Davis Phinney Foundation en Español site, so people can easily learn more about our efforts. And there's a Spanish we have an ambassador program, an English one, which has I think there's over 100 ambassadors. And I think maybe we have 15 or to 20 Spanish speaking ambassadors now also from not just the United States, but other countries like Mexico and Colombia, and I think maybe even Spain. And so that's like a growing community. But we'll put some links in the description about that so people can find out more about those efforts.
That's great. Thank you.
Awesome. Cool. Well, thank you so much for this interview, and just best wishes and good luck with all of your work.
Thank you. Appreciate it.
Thank you for joining us for this episode of the Parkinson's Podcast. For more information about the Davis Phinney Foundation and to learn about educational offerings and community events for people affected by Parkinson's, please visit davisphinneyfoundation.org or dpf.org. This podcast includes information about Parkinson's and insights from our Parkinson's community. It is not intended as a substitute for treatment advice from your own medical providers.